afternoon, ma.
Good afternoon.
Yes. I want to find out from you why you're having this conversation. Why is it so necessary?
Okay. For years before now, I had, while still in Nigeria, I had done a lot of work with youths. At a point, I had a rehabilitation center for girls that were sexually abused and then coming out of commercial sex work. Also, I had done work with married couples and all of that. And I found out that mental health issue was a major issue and that we were not equipped to handle it. I didn't have the right training. I looked for courses in Nigeria to train. When I saw that there was a need in mental health, I actually tried Unilag, and I was told that it was guidance and counseling. And it was in the College of Education. I have to do a program in PGD in education. And I knew that wasn't really what I wanted. And so I went abroad to train in clinical mental health because I realized that there was a conversation we were not having. And I discovered that many issues to do with even health issues, physical health issues, had to do with our mental health state. And when we're in good mental health, we will have less need for doctors. In that, and I don't mean that in a bad way, because I mean we don't want health crisis. We don't have enough hospitals and doctors to even help the problems. So when we are in good mental health state, then people are healthier and they're better off. And when people know how to talk, there are people to talk to you, and people not just say anything to you, but they have the right answers, or they know how to pull information out, from you. Then people are happier. And so that started my journey of learning about mental health. And after doing that, I realized that one person cannot build a nation. It takes a team, it takes a group. And I decided that, okay, I'm not going to stay in the US. I'm going to continue to learn, and I'm going to replicate myself. And that the best way to replicate, because after learning, I realized that we cannot, how many people do we want to take through school of 10 years? But that mental health is something that you can put in the hands of, your neighbor, people that have contact with a lot of people. So I made it a duty to decide to train non-mental health professionals, that people like nurses, doctors, teachers, community health workers, in identifying basic mental needs and learning how to respond with empathy. I find that a lot of people have the answers to their problems only if they have somebody that will listen to them. Some people just want to externalize it, but the answer is there. Just like we learned in class, when you are stressed, you work with your lower brain, your emotional brain, and so you are not able to work with your executive functioning brain. But when somebody sits with you and allow you to pour and to talk, then you begin to reason the information out. And you get up and you go with answers without anybody actually really helping you.
What's the rate of this mental health issue in Nigeria? I think statistics, is it something that's on the increase?
Now, that's a good question. Some people will say, oh, we've always had mental health issues. It's not on the increase. It's just that now we are assessing it or whatever. I had at the tip of my finger, I know that there was an article some years back in 2016 that I think the Minister of Health in Ogun State actually talked about, it was in the Sun newspaper, and said that the mental health situation in Nigeria is reaching an alarming proportion. That at least, he said, over 60% have mental health disorders. And so for me, when I talk about mental health, I'm not even only talking about mental health disorder. I'm talking about the fact that every single one of us experience mental health issues at one time or the other. And if we have the opportunity to find a way to express it or to get help, then it does not have to get to the point of a real mental disorder or mental breakdown. The same way when you have a wound, if you find somebody to help you bandage and care for it, it does not get to the level of being gangrenous and then you cut it off. It's the same way. We all experience mental health issues. We are all experience trauma, sadness, loss. There was an article, I think in 2016, by the Commissioner of Health in Ogun State, Dr. Eniabitobi, that talked about, from what they have analyzed, that over 60% of Nigerians have real mental health issues. And when I talk about mental health, for me, I even talk about everyone has mental health issues. We all experience mental health issues because we experience pain, sadness, loss, disappointment, relationship issues. Erectile dysfunction can be an emotional health issue, but it is when it is not handled properly, because we all have different coping skills, that it now becomes a mental health disorder and problems. Also, genetically, some people have mental health ability to react in different ways because of what they have inherited. And so when you have a mother that has been chronically depressed and has the neurotransmitters has been used up, and there's a problem with its production, it is the same gene that the mother is going to transmit, or the father, to the child. So the child grows up, is born with a predisposition to a mental health issue. So all this is important. But when we have systems in place that allows people to be able to, to be able to receive care and support, then it does not have to get to a point of mental health disorder. So the reality is that mental health issue is everybody's issue. And if we deal with it, then we have a healthy issue. I said this, a person that gets out of his car because somebody hit his car and begins to box somebody else is a mental health issue. Our leaders fighting in parliament is a mental health issue. There is stress that they have not learned to manage that comes out through the hand, because there are different ways in which you express what is in the heart. Either you express it by talking to somebody in a quiet, nice way, or you express it through aggression. It's all mental health issue.
Okay, do you have any call on the government to see that the mental health services get grounded in Nigeria?
The same way we are passionate and we want, even to start with, even our physical health, hospitals and all of that, it is under, it is not where it ought to be. But the reality is that if we have good mental health policies, at the same time, we also make it a priority that as we are developing, we want to develop hospitals, we are looking at developing mental health services. And the good thing about mental health is that you don't need as much funding for that. You don't need big structures and big equipment to set up, to train people, just like we are doing here. We are training mental health facilitators. They are going to go into their different places of work, schools, teachers, and all of that. We don't need to give them equipment to work. And they will be able to work and, help people. At the same time, we make mental health clinical. Our universities begin, develop units where they give clinical training, not just guidance and counseling, so that people are able to do the clinical work as mental health. We give scholarship to people to go and get trained in mental health, and we train more mental health facilitators that can reach out on the in the grassroots and reach to people, reach people that might not have access to psychologists or psychiatrists, and they are able to identify, the needs and attend to it at the early stage before it escalates. And then they're able to identify the one that has escalated and then refer. But the truth is that with mental health, we don't need much to have good mental health services. Yes, I want to thank my partners, actually, that made this happen. Because without them, it was difficult, making this happen. So I want to thank Poor Health International, really, Dr. Ibanga, and then Ajia Fatima Shinkafi from Zamfara. She actually brought a bus load of people from Zamfara to attend this. I also have people that are here working in the IDP camps. So we have different people from different sectors. And I forgot to say something that is very dear to my heart. When I was in Maiduguri in January, near the Sambisa, we went on a mission trip, on a health mission trip near the Sambisa forest. And some of the soldiers came out to talk to us because I was heading the mental health unit. And this soldier was like his whole body was like something was biting him, but nothing was biting him physically. It was stress. And he said, many of us are like this in the forest. We are almost mad. We are going mad. And that unfortunately, the government, nobody is thinking about helping us, helping our mind, because this place is turning us mad. And there's a call also that for a lot of our soldiers that are out there, there's a need to help them, offer them rehabilitation before you reintegrate them back, because the trauma of this war is unimaginable. In the developed countries, before you bring soldiers, when you bring them back, you take them through a lot of rehabilitation, biofeedback, post-traumatic stress counseling. We need all of this in order to be a healthy country.
Honestly, when I'm invited to this program, when I saw the invitation, I saw mental health, and I'm not a health worker. I say, what's make the impact of this to me as a public worker, not health worker, to participate in this program? When I'm in the program, now I realize that it is me, the public worker, that is very important to have this knowledge than the health workers, because we are the preventers. The public servant, we are the preventers from this mental issue than the workers, because immediately when the person is being infected, that's why he's taken to the hospital. But that's why they say the preventer is better than cure. I realized that this program was very important to me, but I learned a lot. It's going to be impact, because we are make sure that we are going to do a step down training across the 14 local government in our states.
Do you have any word for the government?
No. Yes, of course. During the program, we even share the idea that this program is very important to educate our executives, because if we have support from the government to sponsor this kind of program, at least in Nigeria, we have solution to the problem, because we realize that in Nigeria we don't have the problem of poverty is not the one that is affecting the Nigerian people, is the mental health problem.
I was surprised when I received my letter that I was invited to a conference, international conference titled Mental Health, because I'm not a doctor. I'm CBO, Civil Society Organization. But it was when I was in the conference hall, I noticed that everything changed, that people are going crazy on roads they don't know. So actually I acquire much from this conference. In fact, I'm a father, the same thing I'm a brother. So by now I know how to call, more especially the young children, innocent children that have been molested by wicked people. So their present situation, what are the situations they are? You have to all be in focus, or you have to be monitored, because they don't know what is good for their life, because their stage is not up to that. But with this present conference, in fact, I can't call myself as a doctor, but at least I acquire much from this paper titled Mental Health. Yes.
Thank you very much.
My name is Mohamed Rulwan Amin. I came under the platform of Fatima Umaru Shinkafi, all the way from Gusau, Zamfara State. So thank you very much for the initiating of this program. So thank you very much.
As a caregiver and as a reformer, this course has been very helpful and useful to me. In fact, when I get back to the prisons, I'll be more humane in the treatment of the offenders. I think that's very, very important to me. I've picked the idea that mental situation is a very critical issue that should not be relegated to the background. That the inmates in the prison, most of them have health issues, and as such, it has led them to commit crimes, which an ordinary layman may not actually know that is due to the mental situation they are in. That most of the offenders who have raped, abused children is just as a result of the mental situation they found themselves.
Well, we are very thankful to be here and we've been to quite a number of IDP camps in Benue State, and we have discovered that a lot of these people, the trauma of the displacement is even much more than the incidents. So this training has particularly enlightened me, because as a medical doctor, there are some things I wasn't even aware of. I wasn't paying attention to those details. For instance, what they are going through in their mind. We're concentrating on just the physical ailments, diarrhea, malnutrition, and we're trying to treat these things. But we actually relegated this aspect of trying to counsel them and see how we can deal with the post-traumatic stress, because that is what is actually resulting in diarrhea and these symptoms they are presenting with. So this training is going to help me to be able to help them from the foundational issues, not just attending to their symptoms. And I think a lot of medical professionals and other professionals need to go through these trainings, because it's like zeroing in on one particular area, not just being a doctor at large. So for me, it's going to help me to go back to these camps and pay attention to details. How can I help them deal with the post-traumatic stress that they are going through, and how they can reintegrate into the community just by attending to their mental state. Yeah. Yes. Dr. Grace Rimamnura from Benue State University Teaching Hospital, and we serve as Rima Ministries, our own NGO. And so we want to thank our mommy that has facilitated this program. It's really...
So much has been said about mental issues. How did you get? Let me ask you, how did you get here? Where should we go from here? Where do we go from here?
Where we need to go from here is, I would say that we are very lucky to be participating in this seminar today. In fact, it has opened up my eyes to see the society and to see people and to look at them with more compassion and with respect, knowing very well that the things we take for granted, the issue of mental health, a lot of times when people are sick, they are not ashamed to say, oh, I have a headache, oh, something is wrong with me in my arm is aching, my stomach is aching, and all of that. So we need to begin to destigmatize the issue of mental health so that people don't feel that, oh, if I say I have this issue, or if I admit that, I'm not mentally stable at this moment, or sometimes we see people and we call them crazy and things like that. But with this understanding, with the knowledge we have received today, I don't see people and call them crazy. I look at them with pity. I have compassion on them. I look at them like, okay, this person needs my help. This person needs love. This person needs attention. And the key thing that I am taking with me today is the matter of attention, paying attention. You see, when we pay more attention to people around us and in our society, we begin to see where people need help, where they need assistance, and then at the end of it all, we can make very good referrals. So I don't think this training should be taken lightly at all. It's something that we really need to, in fact, everyone needs to participate in it, not just mental health workers, but this kind of training should be done in our religious institutions. Like in the church, you find out that women and even couples are going through marital stress. People are faced with divorce. People are faced with, handling their children, challenges with their children. In the society today, we are plagued with the issue of substance and abuse, drug abuse and substance abuse, and so many issues, business, stress generally in the family, So these are things that with this kind of knowledge, we can actually minimize their effects on our physical health, because once we are mentally helped, or we have that understanding and we manage our mental health, it goes a long way to impact on our physical health positively. So it's been very useful to me, I must say, honestly. My name is Remi Ajayi. Yes.
Do you want to call on the government?
I'm not only calling on the government to support this kind of initiative. I'm calling on our religious leaders. I'm calling on our pastors, our imams. I'm calling on parents. I'm calling on proprietors. and, heads of schools. I'm calling on even heads of corporate organizations. In some offices today, you find out that colleagues fight amongst themselves. I have a first-hand experience of, while in my office, there was always a colleague of mine who was always lost and everything. Well, I have that heart of compassion. So I could understand that something is not very okay with this person. Something is not right. But I can remember some other colleagues of mine who always just, laugh at her, make fun of her, and call her names. So a lot of times we call people names, but it's not them. Something is happening in their brain. So that's one thing I've learned today, that something is happening there in their brain. So we need to be more compassionate. So I'm calling on every strata of our society to look into this, to continue to replicate this training, to people who handle children in churches, people who handle children at schools, and, generally even pastors. They should undergo this training. Sometimes couples have issues and they're coming to talk to you, and sometimes some of these leaders just feel, oh, we shouldn't let this thing be outblown and all of that. So they tend to cover up things. So this issue of us trying to cover up, we bottle up a lot, and eventually it blows out into, another a disease or something. These things can be avoided. So that's what we're learning here today.
Thank you very much.
Thank you.